Hello, 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 everyone. It's Dr. Tamar Beckford, and welcome to the Dr. Tamar Beckford Show. Alrighty, today we are here for all those people who are ready to take their journey of medicine back into their own hands. When you hear it, oh, own your practice. I don't think you can do that in this day and age. This doctor is here to let you know that you can do that. She is going to be talking about micropractices and the new path to freedom. So if you are excited, I'd love for you to continue watching, share this with some of your friends who are like, yeah, I heard about this. Yes, you can thrive in medicine today, believe it or not. Alrighty, so let's get into it with this wonderful sister doc of mine. All right, so this doc, she's a graduate of the UC San Diego Medical School. She went and did her residency at Stanford in internal medicine. In addition to that, she has a master's in nutrition from Columbia, right? Now, she has been featured in NPR. She's been featured in the New England Journal of Medicine and in Annals of Internal Medicine. She is the founder of Juniper Modern Primary Care, which is a direct primary care practice. So, for those who aren't sure about that, and her and BPC, what's that thing? Stick around, you'll hear more about it. And her micropractice is here in Houston, Texas. So hello to all our H-Town people watching. Yes. Now she is able to revolutionize care, leverage automation, integration with AI. Now people are running away from my AI. She's running to it because she's been able to use that to enhance efficacy and to also improve patient experiences. And she's doing that while decreasing her overhead. Now, by year two, she was very successful in business to the point that she earned more than her previous salary. And she was working 20 to 25 hours per week with full control of her practice. Now, in 2024, she's, let me help some of my other docs out. And she launched her practice Mama. Yeah, which is a virtual platform designed to educate and empower primary care physicians with resources, with one-to-one support, with a community to help physicians to create sustainable and autonomous practice filled with authenticity and joy. I'm talking about the one and only Dr. Sonia. Welcome, Dr. Sonia.
Thanks so much for that lovely introduction.
You're doing so many amazing things, and we're really very excited about all that's going on. But I want you to take us back to the beginning where you decided, I want to do medicine. When did you decide that you wanted to become a doctor?
Yeah. So I grew up with a dad who was a physician. My dad is a cardiologist. He's been in private practice for more than my whole life, over 40 years. And
Mhm.
truthfully, being an Indian kid, there was always like this idea of maybe I'll go to medical school. But truthfully, my dad really did not pressure me. And he was always trying to support whatever interests I had. But I do think he influenced me in that he loves what he does and loves medicine and is really passionate about it. And I just saw how much he loved his work compared to a lot of my friends' parents who sometimes complained about their jobs and complained about their bosses. Like he's always been his own boss and he's always loved what he does. And so I think that rubbed off on me a little bit. So it was always in my mind. But when I got to college, I am very logical and practical. And I thought, why would I help one patient at a time when I could work on policies that help hundreds of people, thousands of people. And so I thought I wanted to do public health. And that was what I was thinking for a lot of years. And
Mhm.
I did a public health program that went down to Mexico. And I was interested in the public health part of it. But as part of the program, we would shadow in a lot of different healthcare settings, public hospitals and private clinics and, rural clinics. So I went to this rural clinic and I was shadowing this doctor, actually, who happened to be like very pregnant at the time. It was a little tiny doctor, and she was sitting in a room with a desk and a typewriter, and she had an exam table, and she had her blood pressure thing and her stethoscope. And she would just see patients. Like they would give the history. She would type it on her typewriter. She would do an exam. She would tell them what she thought. She would write a little prescription, and then the next person would come in. And I spent a whole day with her, and for some reason, some magic happened in that room where I was like, "I wanna do what she's doing. That looks cool and fun." And there was something about that, the intimacy of just her and her
Mhm.
simple tools and her hands and her brain and just, like, taking care of these people and making them feel better. And they were all, like, so grateful, and I just that experience really stuck in my mind as, gosh, like, medicine is such a cool profession. And I had done a lot of public health, like, internships and stuff at that point, and it was a lot of, like, paper pushing. Like, I was, like, writing briefs and summarizing policies and like doing stuff in an office. And it felt a little bit isolated and not as fun as seeing a human being. I decided at that point I wanted to go to medical school and went ahead and did it. And I knew I wanted to do primary care. So that's where I've ended up. I think this is foreshadowing to like me end up doing micropractice because that experience I had in Oaxaca, Mexico was so different than what medicine looks and feels like in the United States
Yes.
and what training felt like. And primary care here was a whole different beast than what that was.
You've
And so it's funny now in my tiny little office here with my laptop and my well, I feel like I've recreated as close as I can get to that little clinic that I was in however many 20 years ago.
Wow. Now, the thing that I love about this story, and before we even get in, there's some people saying hi. So, hello, we have Dr. Lizzie. Hi, Jessica. And then Jessica. Hi, Jessica. We're really talking about your Dr. Sonia Singh's interest and how she got interested and wanted to do medicine. And it was right here in front of you, Dad, this entire time.
Yeah.
You put the But I love that you started off with this broad interest that you said, okay, I'm going to go out and I'm going to try to not just say, I want to do this because I see dad's doing it. And interestingly so, you're seeing dad's doing it. And their dad was practicing here in the US also.
Yes, yeah. I'm from
Yeah.
California, born and raised there. He was practicing there, yeah.
All of these technologies, everything, right? This huge set. But then you went to where you found a doctor who was there, and like you said, her little typewriter, and her room, and the intimacy that she had with the patient and the care and that intimacy. And that's what brought you. So it's like that grounded essence of medicine
Yeah.
that pulled you to it. So it's not the big thing. It's like the grounded intimacy of medicine there where, wow, we're at its like element where we get to connect and with people. And so you got drawn in and you started that journey. Now, what made you decide to do internal medicine along the way as opposed to some of the other specialties? Or even like that. Like some people, I'm pretty sure as soon as you went to med school, you'll be a cardiologist.
Yeah,
Yeah,
oh,
at you.
Mom would have loved that. Yeah, no. Even once I was done with residency, I think there were times when she's like, "You sure you don't want to go back to be cardiology fellowship?" No, I don't want to. But like I said, I loved that experience in Oaxaca. I just love that the variety of people that came into the office, like all the variety of problems. That really was stuck in my brain for a long time. So for a while, I thought I wanted to do pediatrics, and I realized when I was doing it that liking kids and just
Taking
like
care of them.
different, yeah, it's a very
And
different.
horrible kind.
And I also think, like, what I was really drawn to, like what you mentioned, is that humanity in medicine. And I love getting in people's lives and hearing their stories and hearing what made them and their whole background. And kids have so little of that. Like you're talking about their birth history and stuff like that. Whereas my adult patients, I always felt like so drawn in by their whole journey. So I realized as I was getting into like clinical rotations and stuff that I was a little bit more comfortable and drawn to the adult patients. And then between family and internal, I think some of it is just like the culture of who goes into it or maybe what's popular at your school. And I just remember being on my internal medicine rotation and feeling like I found my people. I just felt like I fit in with that crew. I was like so cerebral and so into talking about the differential and wanted to have 8 million problems on the lip. Loved every bit of it. And so I jigged. And I think part of me was also like, it feels like too much to also know pediatrics and also know OB. And let me at least
I
like
like some of these people.
so yeah, and then I think there was also part of me that always wanted to keep the door open to specializing if that was something that sparked my interest later on. And so I think that's why internal medicine was attractive to me. And I still think it was the right decision. I feel like that was where I fit and that those were my people.
Absolutely. Hey, for those who are watching and you're hearing the word, those are my people, that is such a common phrase in medicine. When we're rotating and you're making this decision, for those who aren't in medicine and you're listening to our stories, we get 4 years of medical school. 2 of those years, you're really doing didactic. By year 3, you're rotating. And by the end of year 3, you are basically making some decisions about where you're going to land for the rest of your life. Well, so when you are hanging around these people and you're working with their schedule akin to their like lifestyle, you start to foreshadow, say, can I see myself doing this? Do
Yeah.
I see myself? These are the people that I'm going to be going to conferences with, that I'm going to be rotating with, that I'm going to be on the same call with. And you people actually feel great hanging out with them. Well, so I love what I'm doing. I love the people that I'm hanging out with. And yeah, so that's where these are my people come from. And I feel connected to what we're doing and how we are embracing and we're having an impact on the patient's lives. And so some people feel connected in surgery, some people feel connected in peds, and then internal medicine with Dr. Singh says, she's like, I could see myself doing this. I love it. I love it. I love it. All right. So now I need hair. After you finished, you're out in the big one. How was that?
Yeah, internal medicine, I think, is different than family medicine in that our residency training is so hospital heavy. So even if you want to go be an outpatient PCP and you never want to be in an ICU or put lines in or whatever, that's a big part of your training. And a lot of
Mhm.
it is hospital based. So I felt, even though I felt like this was the right field for me, I did feel like I was just doing way more of that hospital stuff that wasn't
Mhm.
that interesting to me and not what I ultimately wanted to do. So it was hard. Residency was hard for me.
Mhm.
And then I got out. I knew I wanted to do outpatient primary care. I took a job with Stanford at my home institution. And honestly, I was really happy. Like I was happy as a clam for probably the first 5 years that I was out of training. And
Mhm.
I think a lot of more people who are farther in their careers will know this. There's a honeymoon period whenever you start an outpatient job like this where you're this and your schedule's not full, your panel's not full, and you're like you have time and breathing room and you're enjoying it. So I was there practicing for 2 years, and then I married my husband who was at Baylor at the time, and so I moved to Houston, and then I practiced here in a big group for another few years. And then 2020 happened, and
Mhm.
2020 was a big year for me because not only was it the pandemic hit, and my husband is a palm critical care doctor,
Mhm.
but I also was like 9 months pregnant when COVID
Oh.
arrived in the US. And I had my baby in like the very peak of shutdown. And then I had my maternity leave and returned to work during the Delta surge. So this was like pre vaccine. It's hard to even remember that time now, how crazy the world
Mhm.
was, but it was pre vaccine. Like everything was still shut down and the clinics were open. And I just suddenly, it was like something about like motherhood and the pandemic, just everything gave me this new lens on life. I felt like I had a new pair of glasses on and I was just looking at everything around me and thinking, this is crazy. What do you want to do? Is this really the right way to do this?
Right?
That's kind of this where the seed got planted and I started trying to think of alternative paths in medicine.
No, I cannot imagine how crazy that time is. For when we hear about like the pandemic, there's so many things that happen, but there were so many transitions that's happening in your life at the same time.
Right.
You're like, okay, I am giving birth. Number one, you're giving birth during the pandemic. If everyone forgot the pandemic, do you remember that nobody was allowed in the hospital?
Yeah.
You remember that unless you are quote unquote essential workers
Yeah.
or you are the patient. So you're not having this, oh, this is my type of person. I want to get home for day running around.
Well, the birth plan went out the window.
Birth plan, the plan for the baby out and getting you and baby safe and out.
Yeah.
Plan. Oh my. And then you it's competent cook care. Like how crazy. For those who are like, what? What does that have to do with anything? All the COVID patients that had to be intubated and isolated, her husband, if that was where he lied. That was his all day, every day.
Yeah.
And then she's having a newborn where for the first couple weeks has no immunity. Scary.
Yeah, we would do distancing. If one of us got like a little if he got like a little tickle in his throat, he would go to the guest room for like a few days. So it was a very, really stressful and difficult time. But honestly, in retrospect, I think if that year had not been so hard, I might not have gotten brave enough or been pushed hard enough to go and do this thing that I did. And I would never be where I am now. So I think the universe The universe
Mhm.
made it happen the way it was supposed to happen.
It brought about that awareness. Like you said, that new glasses, that new
Yeah.
lens on life, and also the lens that the way that we're practicing medicine now might not be the only way to practice medicine, which I think is what's so beautiful about that experience. It was scary, it was like life changing, but it also helped you to expand on the way that you can provide care. And it also had you reflecting on
Mm.
the way that you could provide care, right? Because you said you came full circle. So the decision now came to launch your micro practice. So what made you decide to do a micro practice versus saying, okay, I'm going to get a building?
Truthfully, at the time I made some of these decisions, I don't think I consciously was like, I'm gonna do a micro practice. I'm gonna do I was like building the plane as it was flying. Like first it was like, okay, I just need to quit this job. It's not paying this job and I need to do something different. Then I found the direct care movement through Facebook groups and podcasts and other resources. And again, I had that same feeling where when I got in those groups, I was like, these are my people. These are people who are having the same complaints as I'm having, the same experience, like feeling burnt out, feeling frustrated that so much of medicine is like stuck in the stone ages. Like, why are we not innovating? Why are we not prioritizing patient care and the doctor patient relationship? So, all of that stuff in the DPC culture like really spoke to me. So then I was like, okay, I want to do a direct primary care practice.
Mhm.
And I guess I just to me, it was easy for me to imagine starting off really small and, like, building upon it. So I was like, "Okay, I wanna start off just renting a room. I'm just gonna rent an exam room. I'm just
Mhm.
gonna have my laptop and my I just literally had a laptop and a tote bag with my stethoscope and, blood pressure monitor and stuff like that. And then, I started off just like that, and I would see patients and show up there, and I think they thought I was sitting there all day, but I was really just showing up when there was a patient and seeing them.
Mhm.
When it gets to the point where I'm overwhelmed with the work I have to do, like, I will hire staff, but I'm naturally, like, an efficiency junkie, and I always wanna think about how can I make this process smoother for me and the patient? How can I automate things? Like, how can I make this as smooth and clean and efficient as possible? And there's so many tools now to do that. So I built the practice to be very automated, and
Mhm.
to me, that that doesn't mean that, oh, now everything is like an auto reply or whatever. It means that I'm free to be high touch because I have the bandwidth to do that, and I don't have
Mhm.
to be focused on scheduling appointments and sending people forms and faxing things. Like, I'm really minimizing all of this gut for myself. And then my practice just happens to be a practice focused on women, kind of 20s to 50s. And that was part of my own passion in that period that I was starting the practice. I was a woman in that age range, and I was feeling like I had this baby, got booted out of the hospital in a diaper. And 6 weeks later, someone's like, how are you feeling? Are you sad? Okay, great. And I just thought, gosh, like moms need more support. Like these are the busiest years of our lives. Yes, we're mostly healthy, but there's so many transitions and so many things that come up. And they deserve more time and attention with their doctors, and they're craving that and they want it. And so the practice ended up being a practice of just me, no staff, focused on women kind of 20s to 50s. And I do both in office and virtual. But that's it's been a very small price. I don't think I consciously made the choice to do micro practice at the time. But
Mhm.
once I realized, like, what a gift it was to not have to hire and fire and manage staff and to have full autonomy, like, it's just me, I don't ask anyone's permission, I don't have to look over anyone's shoulder, it's just me handling it, and I
Mhm.
thought manageable it was. I realized, like, this is amazing, like, other doctors should be doing this. This is a model that can work for a lot of people.
I love it. Oh, wow. So, couple things. With the automation, like what are some ways that you're able to automate? Because I love what you mentioned too, that when people hear automation, they're thinking like, okay, so now you're divorcing yourself from the
Yeah.
patient. Here we go, the whole thing
Yeah.
that I've been dealing with. But you're like, no, with this, I can now get more time with you and I can get more hands-on time
Right.
to really touch, to listen, to do all the things that you really want and you're craving from your doctor. So, what are some ways that you're able to automate in order for you to get this ability to get some more hands on time?
Yeah. So a lot of it is making sure that the tools that I'm using are integrating and setting them up so that they're all working together so that I don't have to be involved in these processes. So for example, I use Hint as my payment platform, and that's how patients sign up for my practice and they go on auto pay. So my billing is just automatic. It's happening through there. No one is calling and collecting payment information or anything like that. So they're signing up, they're putting all of their information, they're putting their payment information, they're signing all the consents. And as soon as that's done, they get an automatic email through Hint, and that email includes a link to my new patient form, a link to my schedule, and a link to the medical records release. And actually, all of those are been different. Like one is through my EMR, and one is through my forms manager, and one is through, and then I have a link to the app they use to communicate with me, which is Spruce. So they get an automatic email with all of those links that says, fill out this form, make an appointment, sign this release, and download this app. And they can do all that. And I still have not lifted a finger. And all of those apps talk to each other. So now that they've been added to my list, they then pop up in my EMR as a new patient, and their chart gets created. They pop up in my messaging app, so I immediately get a little ding, and it shows me the new patient's name and that they joined. And then when they sign the medical records release, it goes straight into a queue in that forms platform. When I see it come in, I just go in there, I fax it to the number. I click one button to fax it to the number, and then I've sent the records request, and so I wait for the forms to come back. So
Wow.
the whole process from joining to that first visit requires very little effort from me to get the first all queued up to get taken care of. And then in my first visits, I usually don't use the AI note writer, but for all follow-up visits, I basically use an AI scribe tool that allows me to just look at the patient and listen to them. And just that used to feel so indulgent when I did it in like a traditional practice if I just didn't type while I was in the room, because I would be like, oh, I got to type this later and I'm going to get behind. And now I don't type during visits. I just listen. And I use an AI note writing tool to generate my note afterwards. And I tried a few, and the one I have now I think is really accurate and works really well. Those are just a few examples of places that I've built in automation such that like I am not doing the work of scheduling the patient, of downloading a form here and then faxing here and all of those steps.
How long did it take for you to be able to get to the point where you're able to find the tools that integrate? Because I think that's sometimes the challenge. You're like, that person great. I am one. And then they're like, yeah, really
Well,
long.
really didn't take that long. I think I spent I quit my job in September and I opened my practice like the very end of January, like beginning or very end of December, beginning of January. So it took me about really 10-ish weeks to get everything like all queued up. And the deciding just involved trialing a few different platforms and then looking at what they integrate with to make sure that one was talking to the other and talking to the other. And I think the mistake a lot of doctors make is for some reason, they get very cheap about these things. So they'll see that one platform, yes, it has an integration and it's a little cleaner, but oh, it's $50 per month more. So I'm not going to do that. Like I have duplicate services. Like I pay for an extra forms platform because it's smoother and it makes me do less clicks and it makes me able to fax directly from where it is instead of downloading it from one place and putting it in another place. And so I'm willing to pay for that convenience. I use Spruce, which is a messaging app to communicate with patients rather than using my EMR's portal because I don't like logging into the portal on my phone and everything's really tiny. I like using it where it's just very simple and smooth and in its own app. And again, I pay for that extra automation, but our time is money. And I think so many doctors like don't fully grasp the value of their time and how much automating these processes is worth in the long run. So you think, oh, it's just a couple of clicks. I'll just download it here and then I'll upload it here. And it's not a big deal. I can do that. But over 100 patients, that does end up being a big deal. And I think one thing that helped me do it was just knowing the value of my time and knowing that the death by 1,000 clicks. And like you should be willing to splurge a little bit to save time and for the sake of efficiency.
I love that. That's such a great point when you're mentioning that it might be a little bit extra in the forefront, but in the long run, when you think about it, the time and that efficiency, you're probably making back that money in the long run because from efficiency and the headache.
Yes, there's
Absolutely.
tips.
Oh my gosh, you were speaking my language when you said the death by 1,000 clicks. Like I remember some of the EHRs when you're just trying to order one thing. Just one
Yes.
thing. And it's 5 clicks for one item. Alrighty, so we had Usman Javeed. It says, what recent advancement in internal medicine are you most excited about, and how do you incorporate them in your practice? Javeed, I just heard part of the EHR, but go ahead. And additional advancements that you're excited about.
I mean, the broader category is just AI in healthcare. Like, I feel like we are living on the verge of this like huge revolution in healthcare. I see so much potential for what AI can do. The ways that I'm using it already right now. So I mentioned like AI scribing, like I use an AI note writer now to do my documentation. I also use an AI search tool. So I've basically stopped using Up to Date, which is like the go to medical resource for a lot of us. It's expensive to buy as a solo doctor. So I'll see if I can get by without it. And now I've started using a site called openevidence.com. I have no affiliation with it. It's an AI medical information search tool. So with Up to Date, you put in what you're looking for, and their search algorithm has never been that great. And so you see all these articles, then you have to click the article, then you have to go down to the section of the article that's what you were looking for. Whereas in OpenAI, you just type in your question or your prompt and it'll give you an answer for that. And it's only using PubMed and vetted sources. So you're not getting nonsense. And it has the sources listed. So you can go directly to the primary research and look at it. And it answers the exact question you have. So if you're like, what is the appropriate dosing and duration for this antibiotic for this condition? You're not going to the antibiotic page, looking through the ideas, like you've not, well, I'm not just saying, starting working about me. Going straight to the answer to the question. Okay, so open evidence, AI Scribe, and then the last one is using ChatGPT or Doximity GPT. So Doximity has like now a GPT of its own for kind of medical stuff, and so I've used that for writing sick notes, for writing appeal letters for insurance companies for things that they've denied, CT scans, meds, whatever. And it's beautiful because you put in your information or Doximity. If you have an account, it knows who you are. So it'll generate the letter with your name and your address and everything in your credentials and your NPI. And then it just gives you the stop letter and just paste in the patient's name and information. And that's the kind of task that would take me 5 to 10 minutes and be annoying for me to do. And it's
And sometimes even more than 5 to 10 minutes.
yes, yes.
Wow.
The quality of letters it produces, I'm honestly so impressed by. If I'm fighting for a med for somebody, it'll cite the data that med benefit for that condition and it'll have references at the bottom, which would take me forever to do, which is my dream of what I wish I had the time for. But now you have AI that can do it for you. And I think there's limitless potential of what it can do. If my Alexa can put toilet paper in my Amazon cart, why can AI not put a CBC and a mammogram in my order set when I'm talking to the patient and saying that's what we're going to do? So I just think there's so much potential here and we're going to see this huge revolution.
I love it. Wow. We have another lovely doc. Hello, Dr. Janice Walker. Alrighty. So Dr. Walker has a question for you. She's what AI scribe
And
can tell you? It's short for your micropractice. So for those who are just joining us now, so Dr. Singh has revolutionized her micropractice for efficiency. And she's telling us about the ways that she's making it efficient. And part of it is by embracing technology where others are running away from AI. She's, hey, this can help us. So what AI scribe are you using right now that's helping you to really be able to take great care of your patients and have more hands-on time?
yeah, so the scribe tool I use is called Abridge AI. And I think if you go to their website, sometimes it puts you on a wait list, but there is a deal through the Physician Side Gigs group. So if you happen to be in that group, you can look in their resources. There should be like a discount code and a link to get access to it. I tried a few other scribe tools, and this was by far, there was a couple I tried that didn't really. So if you've tried it in the past and you wrote it off because you're like, oh, it wasn't that accurate, I didn't feel like it did a good job, don't write it off. Try another one because I do think there's variability in some of them. And this one I find to be really accurate and good.
Love it. Love it. Wow. So now you're running your practice. And what is the feeling that you're feeling now compared to before? Like this, when you describe,
It's a complete 180. It's a totally different life than I had 3.5, 4 years ago. When I was working in traditional practice, my first patient was at 7:15 or 7:20. So I was usually getting to office like 7-ish. And then my last patient was like 4:20 or something like that. So I was finishing around 5 and then I was struggling to get home. There was a little bit of a commute. By the time I got home, it was like 6. My baby was 1-year-old at the time and like he would go to sleep at 7. So I felt so depleted like a zombie for that 1 hour. Like he got the worst version of me for that 1 hour. And then after he was asleep, I still had to feed myself and spend quality time with my husband. And again, for both of us, I think it was like the worst versions of us that were meeting at that time of day, and then I would go to sleep and wake up and do it all over again, and then even though I worked at point 0.8 FTEs when I was in traditional practice, and so I had a day where I didn't go to clinic, but usually that day I just spent catching up because I was so behind on my documentation, so it just felt like I could never really ever get and my world now is totally different. My son is now in school. I plan my schedule around his school schedule, and so I'm able to drop him off and pick him up, as much as I want. I'm able to block days and go volunteer at a school if I feel like it or be home if he needs to be sick. I see probably 8 to 10 patients per week, so not per day, per week. I actually had a second baby this past year. He's 9 months now, and I had a baby in solo micropractice, and I was able to come back on my own terms gradually, and I was able to plan my schedule around my nursing schedule. It was a completely different experience than the first time around. So really, what I feel like I have now is full autonomy. I also get to be myself and be very transparent about the things that are wrong with the healthcare system, which I felt like this obligation to not talk about when I was part of it. And then the reason I always say like autonomy, authenticity, and joy is like what I want for the people who get involved with Micropractice Mama is because that's what this practice has given joy in practice and full autonomy and just the ability to be myself doing it.
Yeah, now let's talk about you launching Micropractice Mama because you've had 2 babies, one in the traditional way where we're dealing and then one your way, right? And you've seen the difference in how your experience is different. Rest assured. Okay, all right. I know it's like it was in the pandemic for baby number 1, but before the pandemic, you were still during the pregnancy, you were still dealing with regular
Yeah.
standard schedule. And this version where you have a little bit more, where you have more autonomy and you're able to do it your way. What made you decide from those experiences to say, you know what? Other women that have no idea that this is possible. I don't need to launch this. Like, what brought that on?
It was a couple of things. So I think very soon after I opened my practice, I started getting a trickle of messages from other doctors saying, "Hey, this is cool what you're doing. Can you tell me a little bit more about how it's set up and like how you started and things like that?" And I would get I was getting more and more of those over time as my own practice grew. And when I went on my maternity leave after this second baby, I had time on my hands. I was sitting around thinking, and I was thinking, like, I'm still getting these messages. I should probably just make a little document or something that I can send people because it feels very inefficient to be trying to DM them stuff and send them an email. And it's just too much information to say in like one Zoom session. So
Like the text?
so it's right. Yes, and then my husband, whenever I'm just like really engaged in my phone, he's, "What are you talking to somebody who wants to do DPC?" Because I just get excited whenever people want to do this. And so I was like, I'll make this document. And then I started writing it and it just started becoming so long. And I realized this is like a course or something. This is like something bigger. Around the same time, I had a couple of friends reach out to me, like friends from different times in my life, physician friends. And these are women who I think are so smart and so capable and just I look at them and I feel like an imposter. So they were coming to me and saying, "Hey, I want to do what you're doing, but I'm really overwhelmed. I don't know where to start." And I'm like, if you're overwhelmed, clearly there's probably others that are very overwhelmed by this. And it made me feel like, oh, maybe I do know something or I've learned things that like can be valuable for people. And the first couple conversations I had with them, they were so excited by just the very little information that I gave. And I thought, oh, I could do this for more people. Like I could make this a thing. So that's what led to the creation of Micropractice Mama. And main offering that I'm working on is an e-course that hopefully will just on demand hold your hand through the whole process of coming up with a practice idea and then take you all the way to opening your doors and seeing your first patient. So I'm hoping to launch that in a few weeks. But in the meantime, I've been doing a weekly newsletter and a podcast, which is all for free and just free information, value, tips, tricks, strategies, insights from what I've learned.
Love it, love it, love it. Alrighty, so the Micro Practice Mama is coming out. Ready to help those who are ready but scared.
Yeah, ready to
You're in like, right, I know I can do this, but I just need a little bit of help and helping them along the way so that they can open that practice and feel confident and at the same time, right? Alrighty. So now throughout this process, I ask this question to all of my guests. Has there been a time that you have felt burned out? And if it did, what did it look like for you?
Do you mean since I've started my own practice or just in the entire journey?
The journey.
The whole journey. Okay.
Medicine.
Yeah. So I had profound burnout in residency, like really profound. And truthfully, I did not see it coming. The essay I had published in Annals is called Open Letter to a Burned Out Intern. And it is a letter I wrote to my intern self saying the things that I wish somebody had said to me at that time. So if you're anybody who's struggling with burnout right now, that letter is for you. But what it looked like for me is it's funny because in some ways, I should have maybe seen it coming, but I really did not see it coming at all because I was a happy, successful medical student. I didn't really struggle in medical school. I started residency in the place I wanted to be. I got my first choice. I was happy to do it. And within a few weeks, I think the first few weeks, I just had tremendous anxiety. Like I was just trying to
Mm.
do everything right and didn't want to
Mm.
make a mistake and was terrified. I remember my hands were shaking putting in my first Tylenol. What accident with your daughter? And then we got one hour earlier. I'm gonna sign this thing and push enter, and a human being is gonna go and get this medicine and put it in another human being. And I just was just very stressed out by every decision that I was making. Even though in retrospect, like you're watched so carefully in residency, like you have so many people looking over you and you have so many people to ask for help, like probably irrational amount of fear that I had about doing something terrible. But it started off as just a ton of anxiety and I was keeping up. And then at some point that energy just runs out in residency. You're not sleeping that much. You don't have days off. You're not socializing. You're not, all of your normal coping stuff is like really sometimes whittled down. And so after a few months, I just started to feel like I was having to drag myself out of bed to just get to the hospital. And I would just have to give myself a pep talk in the parking lot to be like, go inside and do it. And I just found myself feeling like maybe this isn't right for me. Like maybe this isn't the right thing. And I had no appetite and I had no energy and I just didn't want to socialize with anyone and didn't enjoy anything anymore. And it's funny because we all recognize those as classic textbook depression symptoms. Is it why we like, am I depressed? But it's like, it feels like it's just this thing is making me like, I would go on vacation and I would feel fine. And then I would come back and go, and then you're like, and I, at the time, and what I share in that essay is, you know, at the time, I feel like I met all those criteria. And so the doctor in me was like, okay, look, you have this thing. Like, you have this thing by the definition. You checked all these boxes. You have this thing. Maybe you should be treated for that thing. And so I actually did go in an SSRI for several months in residency. I honestly wish I had a PCP who had made me do that sooner because I do think it was the right decision for me at that time. Would have loved to do CBT and would have loved to start exercising, would have loved to get more vitamin D. I just didn't have the bandwidth or the time to do any of those things as a resident. And so I needed, I think, that help to pull me out a little bit of that. And I also started exploring kind of other ways to use my medical knowledge. So I did an away rotation in medical journalism, which was in New York, and my residency was in California. So I removed myself completely for the situation for a month, and I used my brain differently, and that was so helpful for me to just get perspective again. That residency is this very thing, this little microcosm. It's temporary. It ends. Like it's not the whole universe, not the whole world. Your whole value is not tied up in your performance in it. There's so many other ways to do medicine, be a doctor. So that was really helpful. And then I think once I got to third year, the schedule was also a little lighter. I was able to exercise. Like I got my life back on track. That helped me come out of it. And then I could feel myself in 2020 kind of drifting down that same route of just feeling like all social interaction was gone and I had no time to exercise. I don't have time to go to therapy. I don't have time for, and I recognized it way quicker this time. And I was like, okay, something needs to change. Something needs to be different. And so in a lot of ways, like I say this all the time to my patients because I'm so open about my whole journey, my professional journey, but my journey to direct care and micropractice is my own wellness journey. This is how I have made myself well and how I have continued to take care of my mental and emotional and physical health is by creating a practice that serves me rather than being a slave to my job or my profession. So, yeah, that burnout, I think, was a big part of my overall story how I got here.
It's very empowering hearing And especially for those who are probably in residency, who are probably dealing with this and feeling, I don't know, there is no hope. And you mentioned that one of the ways that you really looked at it, in addition to, yes, you would love to have done CBI and definitely would probably even coaching during that time would have been like group coaching and being able to connect and to recognize, because what happened, if I'm not mistaken, did you end up start siloing yourself because you felt like you're the only one that felt that way? Yes, I've heard nothing doing that. What you
100%, yes.
growing? Which is one of the things that happens when burnout starts to happen, right? You start to just isolate because your mind is telling you you're the only one that can't handle this.
Yeah.
Everyone else is doing
Like,
everything.
what is wrong with you that everyone else is going about their business? And for me, writing that essay was so healing, not only because I was able to say the things I wanted to say to myself, but
Mhm.
once it was published, like the flood of messages that I got and emails that I got from that of people saying that is exactly how I've been feeling. It made me feel so good to validate people that you're not the only one who feels this. Other people might be better at hiding, but you're definitely not the only one.
Absolutely. And I'm glad that you got help. I'm glad that you sought ways on how to heal during that process. And one of them was also you removed yourself from the situation for a while. And if you're thinking you did an away rotation, and for people you're like, oh, you did we shut a month
Yeah.
of just extraction
Yeah.
and then looking and being able to view your circumstances from a different standpoint and like the vintage point and being able to use your brain in a different way that you're it's not feeling so monotonous and feeling, that dreaded energy of, oh my gosh, I got to go back into that place. Like for me, it was always like on call. Hated being on call. Why? Because I couldn't leave the hospital and I didn't like not being able to leave the hospital. It had this feeling of confinement. And for me, that was during the time when if you think of that lonely little child looking through the window, that was me. I wish I see everyone leaving and I see,
Yeah.
but being able to know that was just a small phase in my life and that's not going to be my life forever. But at that point, getting that vintage point and being able to talk to others, being able to see that there is a silver lining and that during this point, your brain will like tell you that it's not, and it will have you viewing everything from a negative lens.
Yes.
Know? So I'm glad that you're able to write that wonderful essay to help for you to heal and also to help others to recognize that they're not alone. They're not alone. Alrighty. So that's another thing. Like I'm seeing this theme, like you're really letting people know that they're not alone. So with that, tell us about how can they get in contact with you, Dr. Singh? Are you taking on new patients? And also, when is Micropractice Mama going to be available and helping all these women? We already answered that one. So, helping all these women or other doctors out there who want to start their practice and you're like nervous about it, but you're like, hey, I have something for you. Tell us all about that and when they can get in contact with you and be available to use this wonderful platform.
Sure. Yeah. Almost all of my links are on my website, which is www.micropracticemama.com. So on there, you can sign up for the newsletter, which I try to really pack it with really valuable, high yield information. It's not just fluff. And I send that out weekly. So you can sign up for the newsletter there. That's also where you'll sign up for updates on the course and when it's going to be released. The website also has links to my podcast, which is called the Micropractice Mama Podcast. It's available on Apple, Spotify, basically anywhere where podcasts are. So you can listen to it there. You can listen to it through Buzzsprout. And then the course itself, I'm planning to do a live webinar to do the first module for free for anybody who's interested in learning more about micropractice. I'm going to cover what the model is, the mindset I think that you need to go into it, and some tools for getting there. And I'll do a sneak peek of basically what's in the curriculum of the course and what I cover so that people can decide if it's something that they want to do. I haven't set a date yet for that webinar. I'm thinking the last week of October, but if you sign up for the newsletter, you will be sure to get updates on when that's going to be.
Love it, love it, love it. So the micropractice Baba is about to come out. So if you want to be part of the list of people who will be available to be or to be in the room when Micropractice Mama unveil, then you just go to micropracticemama.com and get on that list. And you'll also be on her email list, which will provide some great information for you there. So on her newsletter that she's sending out weekly. And then you'll also be the first to know when the Micropractice Mama drops, right?
That's
All right.
right.
Are you taking on any new patients now, Dr. Singh?
It's funny you ask because just this week I made the decision that the practice is really at capacity. So I am full right now, but I am enrolling patients onto my wait list. So if you are in Houston, or even I have some patients in Austin and Dallas who just come here once a year and see me, and the rest is virtual. So if you're in the state of Texas and you're looking for a PCP and you're a woman in your 20s to 50s and want a different experience with your PCP, more of a relationship, you're welcome to look into my practice, which is Juniper Modern Primary Care. And for anybody, the best way I think to connect with me and stay in touch is probably Instagram. So at Sonia Singh MD is my handle, and I check my DMs. I answer those. If you have questions or things you just want to connect, please feel free to follow me on there.
Love it, love it, love it. So you can connect with Dr. Sonia at Sonia Singh MD on Instagram, and you'll be able to connect with her, and then she'll be able to let you know all that's going on in the micro practice, all that's going on in the micro practice mama, and everything. All right, with that, we're gonna end this wonderful conversation. And I know some people holidays, they're like, oh my gosh, Dr. Beckford, I jumped on at the end and I'm not gonna get a chance to hear everything. This wonderful episode is available on our Your Caring Docs website. Just go to urcaringdocs.com, select podcast. You'll see Dr. Singh there for free. Download, send this message to at least 10 of your friends who are thinking about starting their micro practice and they're scared. You guys could do it together, right?
That's true.
For those women who are out there and you are dealing with burnout and you're like, oh my gosh, this burnout is really getting me. I'm losing all my joy, my peace, and I'm not even feeling like, what is the use? I would love for you to join my Thrive program. So, our next set is coming up. I would love for you to just connect with me and just go to Your Caring Docs /Thrive, or go to the Your Caring Docs /Thrive website. You'll find ways for you to connect. Let's do a one to one, just connect and just see a 20-minute free call for us to help you to move from the overwhelm to control, to be able to just see, okay, I can actually pull back some control in my life. Because that's what burnout does. It just throws everything into chaos and you feel like you have no control. So I'd love to connect with you that way. With that, we're going to end today's session. And with it, Dr. Singh, thank you so much, Dr. Singh. So it was a wonderful conversation, and there are lots of people who have joined us and have been asking questions, and you were able to answer all of them. All right, if you guys have any additional questions, at Sonia Singh, MD on Instagram. But with that, we're going to end today. Any last words of wisdom, Dr. Singh?
No, thank you so much for having me. This was great.
All righty, guys, take care and have a wonderful day. Bye bye.
Bye. Oh, Rebecca thing.